This presentation is about the right to a relationship, the road to romance. We are a group of researchers who came together to understand relationships for people with learning disabilities.
My Life, My Choice is a self-advocacy charity for people with learning disabilities in Oxfordshire. Our vision is for there to be a world where people with learning disabilities are treated without prejudice. We try to help people know their right to speak up for themselves and to give people opportunities that might not get in other places.
The National Development Team for Inclusion, or the NTDi as we will refer to them, is a not-for-profit society that has been working for 25 years with communities, governments and health and social care professionals to enable people at risk of exclusion due to age or disability to live the life they choose. We inspire and support policymakers, services and communities to make change happen, change that leads to better lives. We do this through our policy development work, development consultancy, demonstration projects, training and research and evaluation.
We're here to talk to you about the research that we have been doing called Positive Sexual Relationships for People with Learning Disabilities. We will talk to you about our journey, what we did, why we did it and what we found out. We'll also talk about some of the struggles that we came up against and some of the positives that we found. And we're also going to discuss the barriers people with learning disabilities experience.
We hope that you will learn lots from our workshop today. Some of the main things we hope you take away are that you will be able to identify some barriers that people face when having relationships, that you will know some solutions to those barriers, and you will understand what the law says about people with learning disabilities and relationships. You will understand what the law says about people with learning disabilities and relationships.
In 2017, DRILL, which stands for the Disability Research on Independent Living and Learning, had a pot of money available to fund important projects that would help disabled people in the UK make decisions about how they live. DRILL is an organisation that aims to ensure that disabled people live the best life they can by being able to join in and do the things they want to do with the right support. They do this by placing the voice of disabled people at the centre of the work it does. As a result of this ethos, DRILL really wanted to hear from disabled people themselves about projects that matter to them. These projects could be a piece of research that tried to find out about something important to disabled people, such as getting the right support, or a pilot project that tested something out to see if it worked, such as a new support service. When My Life, My Choice and the NTDi saw this call for projects, we came together to develop an idea for some research about sex and relationships for people with learning disabilities. This idea came from some work we did together in 2016-17. This work was commissioned by RICFA and involved us co-delivering training to practitioners around supporting people with learning disabilities to develop positive sexual relationships. This experience and the literature available about the subject of relationships highlighted to us that for many people with learning disabilities, the right to an intimate relationship is frequently and systematically breached through rules, regulations, practices and policies being implemented by commissioned services and support. We felt this issue needed exploring more and led to the research we are going to share with you in the rest of this presentation.
So before we get any further into our research, we want to remind you about the laws that surround people with learning disabilities and their relationships, just like they do with the rest of us. So the 1948 United Nations Declaration of Human Rights and the 1998 British Declaration of Human Rights state that everybody has the right to education, they have the right to marriage and a relationship, and they have the right to freedom of expression. The Convention of Rights of Persons with Disabilities that came around in 2006 also states that people with disabilities should be seen not as objects of charity or medical treatment, but as subjects of people who have rights and are capable of claiming those rights and making decisions for their lives based on their free and informed consent, as well as being active members of society and having the same rights as everybody else. It states that disabled people have the same right to make their own decisions about important things as everyone else. It says that disabled people should have proper support that they need when making these decisions. And if a person really does need someone else to speak up for them on their behalf, there should be rules to make sure this is done properly. This is called a best interest. Disabled people's minds and bodies are completely their own, and they must be respected the same as everybody else. Disabled people have the right to get married and start a family as long as both of the couple want to. They have the right to decide how many children they want to have and when to have them, and they have a right not to be sterilised against their will. And disabled people have the right to family planning and other information to help them decide these things in a format that they can understand. As well as other rights, there's also the Mental Capacity Act. So everybody has the right to make their own decisions unless deemed otherwise. A health and care professional would need to do a mental capacity assessment to see if somebody has capacity or not. Individuals must be supported to make decisions themselves. This might include providing personal information in a format that is easier for them to understand. Just because someone makes what those caring for them to be considered an unwise decision, they should not be treated as lacking capacity to make that decision. Everyone has the right to make their own life choices when they have capacity to do so, just like the rest of us, even if we don't think they're the right choices to make. In 2014, the Care Act came, and it said that everybody, as you can see in this diagram, has the right to dignity and respect. They have the right to they have the right to protection from abuse and neglect, and they have the right of control over their everyday life. As well as all of the other things that make up their well-being, they also have the right to relationships and right to support to have these relationships. We'll talk to you more about these throughout our presentation.
People with learning disabilities often say they are very lonely. MenCap states that many people with a learning disability say that relationships are important to them. But only 3% of people with a learning disability live as a couple, compared to 70% of the general adult population. We think this is really sad. Just because someone has a learning disability does not mean they should be treated any differently to anyone else. We've just discussed this with what the law says.
Perhaps some of the reasons why people with learning disabilities are lonely could be because meeting people is more difficult, social isolation is more common, the balance between risk and rights when it comes to people with learning disability having intimate or sexual relationship is often skewed towards restricting their choices, both in a family home and other living arrangements. Lesbian, gay, bisexual, and transgender people with a learning disability can sometimes face a double discrimination, with their sexual rights denied on a basis of their learning disability, as well as their sexual orientation or gender identity. These social attitudes are restricting, which means that people with a learning disability are often not getting the freedom or privacy to have intimate or sexual relationships.
Almost 1 in 3 young people with a learning disability spend less than 1 hour outside their homes on a typical Saturday. 45% of working age disabled people are chronically lonely, saying they always or often feel lonely.
In a representative survey of 1,004 disabled people, the charity found that 2/3 or 67% of disabled people felt that they had been lonely in the past year, but this jumps just to 3/4 of working age disabled people. 45% of working age disabled people are chronically lonely, saying they always or often feel lonely. If extrapolated to the general population, this equates to 3 million working age disabled people in the United Kingdom. A shocking 85% of young disabled adults, 18 to 34-year-old, feel lonely.
We started working with the NTDi about 2 years ago to deliver some workshops about relationships for people with learning disabilities. Our colleagues at the NTDi then wrote a paper about what we found out. We know that we wanted to do some work on this, and 2 years ago with the NTDi asked if we would like to do a research project, and of course we said yes. We did a lot of research the first time round by interviewing a few people and making some videos about what they knew, but we knew we could do more. We wanted to know exactly what helped and what stopped people having a relationship.
So Dawn's just told you about some of the research that we've done in the past. Now we'll tell you exactly what we did this time. It all started by putting a group of researchers together. I worked on the last project with Jess, and we asked 2 more co-researchers from My Life, My Choice to join us. We then started to have meetings with our colleagues from the NTDi. Together, we came up with a plan of how we would like to do our research. We started by interviewing people with learning disabilities at the My Life, My Choice self-advocacy groups. As we said, we run monthly groups around the county for our members to come together to talk about things that are important to them. We worked together to come up with some papers that people had to sign, and we designed a workshop that we thought was gentle but asked all the questions that we needed. After that, we interviewed people on their own. We did this for people with learning disabilities, and we also did the same thing with commissioners and care providers. We finally sent the survey to people with learning disabilities, family carers, support workers, and commissioners, and we found out lots of interesting things.
People with learning disabilities wanted to have relationships and enjoyed having them. People said having relationships was a really important part of their lives.
People found it hard to meet partners. People said their support staff wouldn't let them have a relationship. People didn't really have any education about sex and relationships. Families could really get in the way when it came to relationships. Support staff didn't feel like they had training to help others to have a relationship. Commissioners didn't know exactly what providers were providing.
Lots of people were unhappy. We felt happy and sad.
We were happy some people had good experiences and were in relationships, but we were really upset and angry at what some people had been through.
Thank you, Dawn and Jackie. You're right. Our research came up with some things that we thought were really good and things that we didn't think were so good. So some of the positive things, or the things that we thought were successful, was that we got to speak to lots of people with learning disabilities about relationships. We also thought it was good that people were actually willing to have the conversation about relationships. We got to speak to and interview people at all different levels of the support chain, from commissioners to providers to support workers who are delivering the service.
People with a learning disability were having romantic and sexual relationships. Some families and friends were really supportive of relationships. There were organisations that helped to introduce people to a potential partner.
Now we will show you the barriers to people having a relationship.
I've got a boyfriend, but I'm not in a relationship with him at the moment. He's my boyfriend, but the staff won't let me give him a cuddle or a kiss. They told me not to get married to him. Well, I'm 29 and I really want a relationship with him. We don't do much together, we don't even go out together. He does come down and watch TV with me, but we're not allowed to go in each other's bedrooms.
I don't know really. If the staff the staff are saying don't think it's going to work. Us living together and then married. The staff weren't letting us do what we want. We used to come to Oxford on our own. We don't need guidelines, we're both adults, aren't we?
Because I said, because of my disability, I find that I'm getting a girlfriend. Because people look at the way you are and they don't look at the person, they look at the disability, and I think I get let down all the time. You have a relationship, right, is also, yeah, you got to have money together. You buy drinks and you buy food and stuff like that, and like Valentine's Day flowers or chocolates. But with a girl, it's expensive. Same as if it was a blow stuff for your boyfriend or whatever. You know, when you get married, if you ever got married, if it went that way, then you got to pay for the wedding, you got to pay for the photographer, you got to pay for everything. It's not cheap, it's expensive.
We found that some families were a barrier to people having relationships. Some families felt that their family member should just not have a relationship or wouldn't understand relationships. They saw their family member as maybe a child and wasn't allowed a relationship. And they were worried about the consequences of a relationship. And this was a feeling that some of us ourselves had also had from our families. Jackie, family happy for you to have a relationship?
No,
And why not?
because they thought I was still their little girl.
But what did you want?
I wanted a relationship.
And what happened?
I told Mum and Dad to mind their own business.
And Jackie, how long have you been married for?
11 years.
Amazing.
We found that some friends were a barrier to people having a relationship. They didn't like their boyfriend or girlfriend. They were jealous. Some people lost friends and some were even bullied.
We found that support workers were a barrier to people having relationships, not believing that people with learning disabilities should have relationships, and they were worried about the consequences of those people having relationships. We experienced these barriers when we went to one of our self-advocacy groups to do one of our workshops. We ran the workshop and it was going all fine, but then we heard snickering sort of in the background from some of the support workers, and we ended up having to stop the session because they were uncomfortable about the contents of the workshop, about relationships and talking about sexuality and things like that with the members. Some of the support workers wanted to speak to some of us, but they only wanted to speak to those of us who didn't have learning disabilities. And they got those who did have learning disabilities out of the room, and they didn't want to discuss the reasons why they were stopping the workshop with them. They told us that they didn't feel comfortable with us running the workshop. They were scared about what the families would think. And they also used the Mental Capacity Act as a reason for why these people shouldn't receive this training or receive this sort of discussion.
We were very disappointed that they didn't talk to us. They sent us outside like naughty school children, and then they used the Mental Capacity Act against us.
Some staff members had cultural differences which led them to disapprove. Some had moral issues with relationships, and some of them had little or no training to support someone to have a relationship. Some staff didn't have enough hours to support someone to have a relationship. Some staff clocked off early from events, nights out, or had staff changeovers, which meant that people with learning disabilities couldn't attend their activities, like nightclubs and things like that, where they could start up those relationships and friendships. And we also found out that some people didn't have many staff to cover social events like dates or nights out.
We found that some support providers and commissioners are a barrier to people with learning disabilities. We don't always know what the staff are doing. There are no policies that are specific to relationships.
Sometimes policies that are written are not always followed. Staff don't always have the confidence to use or apply these policies to the particular situation. And some told us that they didn't have the confidence to go against what they're told to do when regards to supporting somebody. They said that actually they felt uncomfortable or unsure if they were allowed to do those things because they'd not been told that they were allowed to do them. Some providers are supposed to provide training, but this isn't always done. And quite a lot of the time we found that this wasn't done. And policies and training naturally became out of date, and follow-up training or policies hadn't been created or done. We also found that for individuals, people with learning disabilities, they felt that there was just that lack of the human element. And this was having a real big barrier to people having relationships. As I just said, people weren't putting the person with the learning disability at the middle of everything, and they didn't think that they could go against what they had been told to put that person first and their needs first. People's care plans didn't always include social activities, things like going out to nights out or going out on dates or different activities where they could meet friends or have relationships through. And very few conversations even happen about relationships. A lot of the time we focus on the other parts of the well-being wheel that we see in the Care Act, but we don't focus on having those relationships. And yet we all know how good we feel when we have these relationships, when we're in love, when we have friends, when we communicate with people on a regular basis. But these conversations just aren't always had when it comes to people with learning disabilities.
Some support staff told us there's a limit to the things that they can do in the short time they share with people they support. So that means that they apparently focus more on the essential things about buying food and preparing food and things like that. And they don't see having a relationship as an essential thing for people with learning disabilities. As well as that, policies are sometimes created with people with learning disabilities, but this isn't always consistent, and that means that these policies don't really cater to the things that people with learning disabilities really want and really need. There's also an emphasis on the staff rather than the person they are meant to be supporting.
We found that different living arrangements can be a barrier to people having relationships. Having a certain time for when you have to be home. Not being allowed out on your own. Living far away. Not having access to public transport. Not being allowed to have your boyfriend or girlfriend over unattended. Not being allowed to shut your bedroom door.
Not being allowed a cuddle on the sofa, only having a single bed, not enough staff, not being able to live together.
We found that money and people's different financial situations are a massive barrier to people having relationships. So not having enough money to go out and enjoy things or go on dates, and not being in charge of your own money and having to ask. So it's having to ask if you can use your money to go out on a date or to buy a gift for someone, or not having enough money to buy a gift for someone, as one of our friends told us.
Not being able to buy things that you would like presents or chocolate. Not having money to travel to see your partner.
We found that there was a lack of resources, which is a barrier for people having relationships. There's very little easy read sexual information out there, and there's also a lack of information about consent and what it means. There's a lack of information about where you meet people, a lack of social outings outside of a day centre. There's a lack of information for staff and families and friends to support someone to have a romantic relationship. There's no information about sexual orientation or sexuality.
So we found that there was a lack of specialist support for people having relationships. We know that there is some out there, but individuals themselves didn't have that specialist one-on-one support to enable them to have a relationship. We found that there's also been a lack of sexual health specialists for people with learning disabilities, with it often being assumed that people with learning disabilities won't use their services, and little to no training for support networks to help someone with learning disabilities. So we found out from our own research group, personal experiences, and from the experiences of those we spoke to, that there was a lack of teaching and information about different types of relationships, a significant lack of education at an early age, a lack of school teaching, and lack of conversations during support hours about relationships.
Lack of people to talk about relationships, actively being kept from learning about relationships, little or no training for others to aid in relationships.
We knew we wanted to keep working on this research. It's important that people with learning disabilities also have opportunities to have relationships. We wanted to see what other people were doing about this.
The Tizard Centre were doing their own research and work around relationships. We were all doing lots of good things, and we wanted to work together to tell more people what we have found out. But we worked together with the Tizard Centre and the NTDi to work on a charter for people's rights to relationships.
This is called Relationship Charter.
This charter was made to help people know what their rights are around sexuality and relationships. This charter was made to help people know what their rights are around sexuality and relationships. The charter says lots of different things. It talks about your right to privacy, it talks about your right to contraception, and it talks about your right to expressing your gender and sexuality. It talks about lots of other things too. People need to know so they can speak out if they are being stopped from having the same rights as everyone else. We want you to share this charter with people you know so everyone knows their rights. You can find this charter on the NTDi website and the Supported Loving Network's website.
We have some top tips to share with you to help people with learning disabilities to have relationships.
One thing we would always stress is to always use a person-centred and co-produced approach when creating policy or care plans.
Nothing about us without us.
And make sure to plan cover so that people are able to go to their social events.
Take the time to get to know someone and open up conversations about relationships. Look out for and request when you can accessible information about relationships. Make sure you are comfortable talking about sex and relationships.
Explain the thing in an easy way. Don't just assume we would or wouldn't understand. Don't underestimate us. Thank you for listening.
With thanks to the research team, Pam, Jackie, Jess, Lisa, Vicky and Dawn.